So the career that I chose to do is medical assistant, and the job responsibilities of a medical assistant include completing administrative and clinical tasks in the offices of physicians or in the hospitals. So these responsibilities include recording patient information and history and measuring vital signs, helping with patient exams, giving patients injections or medications as directed by the physician, scheduling patients' appointments, and preparing blood samples for lab tests, and also entering patient information into medical records. So it's important that medical assistants are able to keep this information confidential and to only discuss it with the other medical personnel who are involved in treating this patient. And medical assistants must also know the electronic health record software that their particular office uses. In larger offices or hospitals, medical assistants may specialize in either administrative or clinical work. So, the administrative medical assistants oftentimes fill out insurance forms or code patient information, along with answering the phone and scheduling patient appointments. And clinical medical assistants instruct patients on medications. They prep patients for x-rays, they remove stitches, draw blood, and do other basic lab tests. So there are no formal educational requirements for becoming a medical assistant, but you do need to complete a medical assistant program, which is available at community colleges, vocational schools, and universities, and they are typically about 1 year long in length. Although you technically don't need to have a bachelor's degree in order to become a medical assistant, it's obviously better if you do have a degree related to health. That way it will increase your chances of landing the job that you want. So some important skills that a medical assistant should have are good analytical skills, because they must be able to understand medical records and diagnosis. They must be detail-oriented because they need to be very precise when taking a patient's vitals and also when recording patient records. Another important skill that medical assistants should have are good interpersonal skills, because they are going to need to be able to discuss patient information with other physicians, as well as interact with patients who are oftentimes in discomfort or pain. According to the Bureau of Labor Statistics, the job outlook for the next 10 years is a 29% increase, which is much better than the average. So the reason why I chose this career is because you get to work with patients, which is something that I want to do. And I also think that it's a good job to have if you plan on going to grad school, because that way you get that medical field experience. And also, it's a good way to get clinical hours if you are applying to grad school, because you do need to be certified to get those clinical hours to get into the certain program.